Good morning, everyone, and welcome to our next installment here at the Richmond Public Library. I'm excited to be sharing and doing this talk again, actually, to do with our bone health, especially the term osteoporosis, as many of us are familiar with. So we're going to start it off with talking about what really is osteoporosis, because the biggest truth myth bug here is that calcium will support osteoporosis. And I'm going to be debunking that. But what really does contribute to osteoporosis? Because once we understand what happens at the level of our bone, then we know how we can actually support the health of our bone. And thus, the last point approaches to osteoporosis, especially what I do in my practice here in Richmond. As a disclaimer, again, this is actually meant to be just informative, not really intended to replace any medical advice or meant to be relied upon to treat, cure, or prevent osteoporosis. This is meant to be brought up to your medical doctor, family physician, or nurse practitioner to engage that conversation and to know how you can support your bone health today. But the attendance here does not establish the patient-doctor relationship. And again, this presentation is not meant to diagnose you or treat you with any of the following supplements that I discuss. Please do refer to your healthcare practitioner if you have this condition and you're inquiring if you can benefit from any form of supplementation. So we see a lot of new faces, so I'm really happy to introduce myself again. My name is Dr. Romy Fung, and I am a practicing naturopathic physician here in Richmond, British Columbia. I hold a general practice and have been in practice for just under 3 years. I'll be hitting that 3-year mark as of July 1st. So I'm quite excited that's quickly approaching. But on top of my general practice, I have clinical interests and special interests in treating those with dementia and Alzheimer's disease. And I take a very kind of thorough, investigative approach when it comes to many chronic conditions, not just dementia and not even just osteoporosis, but anything long-standing from cardiovascular disease, diabetes, digestive health. These all take time to begin with. And because it took time to build up, there's no silver bullet to it, unfortunately. There are many factors. And as you learn in today's presentation, there are many factors when it comes to the health of the bone. And so my fascination of the human body comes from the fact that there are many things happening at once, and we have to address those many things in order to see a difference, in order to, I was going to say inflict change, but you understand what I mean by there, and to really just turn the wheel to the different direction when it comes to healing. So I did my pre-medical training in health sciences from Simon Fraser University, and shortly thereafter went on to completing the Doctor of Naturopathy program at the Canadian College of Naturopathic Medicine in Toronto. The other medical school in naturopathic medicine is the Boucher Institute of Naturopathic Medicine in New Westminster. And as of February of this year, the Canadian College of Naturopathic Medicine and the Boucher Institute of Naturopathic Medicine have declared that they'll be merging together to forming the all-inclusive Canadian College of Naturopathic Medicine. Having completed the program, I got licensed in 2018 and started my practice shortly in Richmond. And while I was practicing, I saw quite a few seniors and older adults as patients. And even though my interests lie in the older adult population, I felt like there was more to grasp regarding their level of care and their lifestyle and their livelihood. And so I took it upon myself to completing a master's in aging and health from Queen's University while I was building my practice. And as I was doing these talks last year, I was talking to Winifred about this. Doing this talk last year, I still had it as Master's of Science in Aging and Health candidate. So it's kind of interesting to see how things just develop over time. But while I was completing my graduate studies, I was offered actually by my professor, now supervisor, to pursuing a PhD in aging and health. And this is expected to be completed by 2024, where my thesis is likely going to be based upon de-prescribing guidelines, especially when it comes to antipsychotics in patients living with dementia. So I'm very excited to be conducting the research soon once I complete the comprehensive exams, which are going to be happening in June. So enough about me. Let's get started, because I'm sure you're all dying about this. So I'm going to start with a myth. And this myth might actually startle. The first myth: supplementing only calcium prevents osteoporosis. Now, this is a very common kind of conception where when one gets into a state of thinning bone, which we call osteopenia, leading towards osteoporosis, which is thinned bone, the condition of thinned bone, that they're told, whether that be by a medical professional, a family friend, family member, or any other health practitioner in between, to take calcium for bone. Now, it makes sense in that 60% of bone is calcium, but what about the other 40%? If you saturated all calcium stores in the bone, is it going to help with osteoporosis? Chances are it may not. In fact, there's a 2015 study that took, it was a nurse's study, and out of 100 women who were given a supplementation for calcium in order to prevent osteoporosis, out of 100 women, 3 women were prevented from osteoporosis, but 6 got stroke. And if you look into kind of the physiology behind calcium, then there is that kind of deposition with calcium depositing into the blood vessel, and can potentially lead to what we call atherosclerosis, or the building of plaque in the blood vessel, and also potentially stroke. And another common conception when it comes to calcium is that the highest source of calcium comes from milk. So let me just look into here. There's also, let me just take a step back. There is also another study in 2018 that looked at calcium supplementation in osteoporosis. Did they find it to be useful, or did they find it to be harmful? And so let me just add my pen here. And so looking at the first line right here, there are 3,200, almost 3,300 participants. And even though they found that about 85 people were prevented from a hip fracture, there is at least almost 20 cases that caused harm. In another study, the second study right here, you have less benefits and more of the harms besides constipation right here. So is calcium causing all this? It's potential, and that there is some level of prevention, 14, 16, 13, but look at how big these numbers are in terms of the number of participants. So in order to get 14 cases of prevention of hip fracture, they had to supplement at least 36,000. So is calcium that miracle supplementation when it comes to osteoporosis? This study has shown that it takes a lot of people before you actually start seeing something. And so it may or may not be the case. But the second myth here is that dairy is the only source of calcium. There is another study done, I believe in 2018. Yeah, I was just searching it up right here. And in 2018, it wasn't using calcium supplementation, but rather dairy consumption and looking at seeing if there is any prevention of hip fractures or any not causation, but correlation of fractures or any other form. And they found that dairy consumption is almost equal to the control, meaning dairy did not prevent, and it may or may not actually be harmful when it comes to causing hip fractures. And there are other sources of calcium. Dairy is not the only source. So if you're looking into whole food sources for calcium, there are many other foods that you can potentially ditch the milk and look into foods such as sardines. Even dark green leafy vegetables have some level of calcium in them. Now I'm just gonna, I don't know why this milk is right here, but otherwise, a lot of our foods that we're likely having in our diet right now has some level of calcium. Even broccoli has some level of calcium, though I think there was this one commercial, I don't know if anyone of you remembers, but I remember this being several years ago. And it was a commercial of calcium and how women were trying to get their daily sources of calcium. And there's this one lady that was eating probably like a whole popcorn bowl of broccoli as a way to get her calcium. It didn't look kind of convincing, but my message here is that there are other food sources of calcium, and you don't have to just depend primarily on dairy. Here are other plant-based calcium sources. So yeah, I could probably do bingo right here. Broccoli, okra, edamame, tofu. Carrots even have some level, parsley, quinoa, tomatoes. Well, I can call bingo right there, but yeah, there's a lot of sources of varying levels of calcium. And chances are, if you eat a variety of different foods, you're likely getting quite a bit of the nutrients, including calcium. So let's get on with what osteoporosis is. So looking at the right here is a picture of a healthy bone in comparison to a bone that is thinning and is starting to get more porous. So you see these kind of pores that are coming, and that just makes the bone more brittle and less strong. And once you get to a specific point, and this can be measured by something called a DEXA scan, which we're going to talk about in a bit. But when it gets to a certain point, then it'll be called osteoporosis, and you'll be likely graded based on the DEXA scan. But it's this um, it's this thinning of the bone that puts you at risk of breaking the bone, whether that be a incomplete or a complete fracture, or even bending of the bone. When I think of osteoporosis, I don't really think of just, calcium, as we heard from myth, and that if bone is thinning, why not just give it the calcium it needs to build stronger? And if it was that, if that was to be the case, then why are there so many people suffering from osteoporosis? If it was ever as simple as supplementing with calcium. Unfortunately, it's not really that easy when it comes to osteoporosis. When I think of osteoporosis, I think of it as a really dynamic kind of exchange. It's like a dynamic dance where both partners have to go back and forth. And so in normal bone, in the top right here, you have some part that will build a bone. And in medical terminology, that's what we call an osteoblast. And the way I remember it is blast starts with a B, so that's to build. And then there's something that actually breaks bone, and we do need bone to be broken to have access to the calcium stores. Because believe it or not, you need calcium for other things rather than just bone. And in order to get access to that, the body also needs to find a way to break that. And that's what we call an osteoclast. And so this has to be balanced in order for bone to stay strong. But if you have something that consistently breaks bone without being able to replenish it as much, then you're going to lead to that downfall, destruction, and thinning of the bone. So it's merely a balance. And everyone who supplements calcium and other bone supplements is helping build the bone. But if you don't address what is actually breaking down the bone, then you're not really looking at it from both sides of the coin. This is probably the biggest message I have to say for everyone when it comes to not just osteoporosis and bone health, but for anything to do with chronic health. Just like with the brain, for example, you can have things that build the brain, and a lot of people turn to fish oils, vitamin D, magnesium threonate, etc. And that is really good with building the brain. But if you don't address what is impeding on the health of the brain, then you're not really looking at it from the root cause. You're not looking at it from the underlying causes of disease. So this applies when it comes to our bone health and osteoporosis. So what is it then? We go back here. What is it that is causing our bone to be depleted, to constantly thin? And there are many things that we're going to be learning today. So hold on tight. But the first thing is inflammation. Now, inflammation, you're probably going to say, but that is such an easy way out to just tell anyone that they're inflamed. But you have to understand what inflammation does, not just on a local level, meaning if you were to injure your elbow scraping on something, you see that redness that comes out of the elbow, and that it starts to kind of swell and maybe even fester. So that's local inflammation. But then there's systemic inflammation, which happens throughout the body. Now, we heard about, or we talked a bit about the osteoclast that helps break the bone to have access to the calcium. And we know that osteoclasts are very sensitive to anything regarding inflammation. So the communication the body uses for inflammation, which we call inflammatory cytokines, it can actually tickle, so aggravate the osteoclasts. And if you activate the osteoclasts from the inflammation, that could actually pretty much turn on more of that bone breaking, and that could promote increased bone loss. So there are a lot of inflammatory diseases that can arise all over the body. And that includes things such as arthritis, but it also pertains to our gut. I see that if our gut is inflamed, chances are our whole body is inflamed. So gut kind of conditions, not just with things such as inflammatory bowel disease, but even just food sensitivities can actually play a role in increasing our inflammation levels, inflammatory levels. But where does the gut start? Where does the gut begin? That also plays a role in inflammation, and that has to do with our oral cavity. So, our oral health, especially when it comes to periodontitis, that can actually play quite a role in systemic inflammation if you don't thoroughly maintain the health of your oral cavity. So proper flossing, proper brushing, blushing. And there's actually links with the inflammation coming from a compromised oral cavity and brain health. It's a big connection right now. So wherever inflammatory diseases occur, the systemic effects of bone will then ensue. And that increases fracture risk. Because once the cellular and signaling pathways are turned on for inflammation, that pretty much just aggravates and irritates these osteoclasts to then promote more of their activity. So where are these sources of inflammation coming from? Well, there's chronic infections, chronic inflammation from arthritis and pro-inflammatory diets. Acidifying diet, we're going to talk a bit about that acid-base balance. Any foods that are very simple, so simple carbohydrates and sugars, because once you get a high glycemic index, you're going to spike your blood sugar levels, and that would make your body more prone to something called advanced glycation of ages. So it's this production of why can't I remember this now? It's probably too early in the morning right now. But what I'm trying to say here is that, okay, I'm getting a message here. Someone trying to help me. Yes, thank you. Advanced glycation end products. Oh my goodness. So what that means is when you have a lot of blood sugar going on, or sugar in the blood going on, it forms a irreversible bond with any protein. And in this case, it could be your red blood cells or the blood vessel. And if it is irreversible, then the body has no choice but to try to destroy it. That's the only way the body can get rid of it. And that requires inflammation. And so having a history of diabetes or insulin resistance. So this is when your insulin becomes resistant and is unable to control your blood sugar levels, then you're going to lead to more production of these end products. and that could lead to more inflammation. Food intolerances, food sensitivities can really also ramp up the inflammation. Having a imbalance in the gut microbiome or intestinal dysbiosis, oral health and dental problems, being obese, and definitely when it comes to chronic stress. Having environmental toxins, the body's going to want to clear that and detox that. But if it doesn't detox that as fast as possible, then it actually gets to stay in the body, and then the body is going to see that as foreign. Many drugs also have this inflammatory component, and even turning down inflammation, though it sounds like it's the therapeutic route, may actually only address the symptomatic picture of inflammation. We need to find out where and why this kind of inflammation is coming out. So another thing here that I briefly talked about is acid metabolism. So there's a lot of misconceptions when it comes to the acid-base, I guess you could call it acid-based diet. Some people are saying that you need to have alkalinic water or basic water to help with the body's kind of health. And, you know, there is some sense to that, but the thing is, our bodies are very smart. And our bodies conduct something called homeostasis, where if it gets too high or gets too low, it's going to want to buffer and bring it back to balance. So looking at the pH scale, which is the scale used to measure how acidic or how alkalinic something is, we're going to look at our blood, for example. And our blood is a little bit on the basic side at around 7.4. But it's more or less more on the neutral side. But our bodies are really good at making sure that our blood, as well as anything, stays within boundaries. And so if it does approach one boundary, whether that be more on the acidic side, so going up here, or more on the basic side going down, it's going to want to bring it back to center. A lot of our diets right now, especially the standard American diet, is really rich in protein and sugar, and very low in vegetables and minerals such as magnesium. And this puts the body more towards this going up acidic direction. And so when the body hits that boundary that it should not pass, the body will try to buffer it. And how does the body buffer acid to bring it back to this balanced blood pH level? One of that has to do with calcium. So if your body or if your lifestyle and other underlying conditions are putting your body more in a acidic state, the body's going to want to just pull it back and bring it back into, I want to say neutral, but it's not technically neutral, but you know what I mean by neutral or balance. And in order to do that, it's going to have to break more bone to get more calcium out to then be able to buffer that. So if you're constantly getting into that state, then the body's going to want to just constantly buffer that and will take as much bone as it can to buffer your blood pH. Because if your blood gets to a certain point, if it passes a certain point, then the protein in the blood is going to denature and you may not be able to survive. That's why the body is so smart in actually keeping that balance, especially when it comes to blood pH. But in order to do that, it's going to have to take a lot of resources. And thus, if one is eating a diet really high in protein and sugar, which is very acidic on the pH scale, then the body is going to want to make sure that it just brings it back to balance upon eating those foods or upon having that kind of lifestyle. There are a lot of drugs and prescription medications that also may in fact contribute to increased bone loss. One of the most common medications has to do with something called a corticosteroid, or that it brings down that inflammation. But as it brings that down, some of the calcium is also kind of depleted. So one of the most main medications that we tend to make sure that that your bone health is optimal while you're on it is something called prednisone. And I know a lot of patients that are on long-term prednisones may in fact be overseen by their doctors to be prescribed another medication to ensure that their bone health is as optimal as possible. So these are certain medications such as alendronate and risedronate, and these help with building the bone. So usually your medical doctor would be overseeing this, and they would actually make sure and take these kind of measures. But there are many other medications that may contribute to the increased bone loss, including thyroid medications, anticonsolvants, aluminum-containing antacids. It's ironic because when we think of Tums, we think of having the calcium coming from Tums. But aluminum can actually, like a few other heavy metals, can displace calcium and other proponents from bone. Loop diuretics when it comes to blood pressure medication, and many other hormones. One other thing that really causes, I shouldn't use the word cause, but correlates with the increased loss of bone is the fact that we've become less active. And bones are just like our muscles. If you don't use them, you tend to lose them. Just like with exercise, what exercise does is not just training the muscles, though that is a part of strengthening bone, because when the muscles get stronger, it's going to want to pull on bone more. And the bone then has to respond by becoming stronger. I think of this as kind of like, when you're going to IKEA and you buy yourself a piece of furniture, like a shelf. With IKEA, you're going to be given all the raw materials and the instruction booklet. The raw material is our building blocks. So calcium and all the other minerals that pertain to bone. But it doesn't just build like that. How would the body know how to build bone? And that requires a message. That requires instructions. And I see that physical activity, especially resistance training, with some level of resistance, some level of weight, that actually sends the message to start building bone. So one could start supplementing all the calcium and all the kind of nutrients for bone that they want, but if they don't provide the body with the right instructions, it's not going to be best utilized. And one of the most common things or common conditions that are overseen would be the fact that women who get beyond menopause are also more at risk of developing osteoporosis. And that is because estrogen does have a protective role in our bone health. And so more precautions are definitely made for those women who are postmenopausal. So how do we approach osteoporosis? How do I, as a naturopathic physician, approach osteoporosis? Well, several fold. This is probably a long list right here, but I'm going to go through them one by one. But first off, to restore proper digestive and intestinal functionality. So if your gut, and also I'm just going to add here, restore eubiosis, meaning the dysbiosis or the imbalance of gut bacteria. Because if your gut is not functioning well, then there are a few things that can happen. One is you're probably not going to absorb foods as readily as well as you can, or even digest foods to then be able to absorb the nutrients, including calcium. But if you are also exhibiting food sensitivities or a leaky gut, where foods that shouldn't be leaking into the body are actually doing so, that's going to cause an increase in inflammation. And that could elicit some of the detrimental effects of chronic inflammation. And in this case, in initiating the osteoclastic activity to break bone even more. Having an ideal weight, because if you are overweight or obese, chances are you also are carrying that inflammation coming from that weight. Eliminating or reducing any sources of intoxication, and that includes things such as heavy metals, aluminum, and so forth, because it's foreign to the body, and how the body gets rid of it has to also recruit inflammation, and that requires, the liver. Of course, we can also incorporate specific herbs, specific supplements, and specific nutrients, as well as an anti-inflammatory diet to jumpstart the bringing down of the inflammation. So that's what I mean by anti-inflammatory natural therapies. Balancing your hormones, especially in with the remains we have with estrone, which is the predominant estrogen in postmenopausal women. Any nutritional deficiencies. So even we were talking about magnesium, and magnesium also has this anti-inflammatory action, and we are getting more depleted from magnesium from our diet. So that's some of the examples regarding nutritional deficiencies. But even vitamin D, for example, also has a really strong anti-inflammatory aspect. Replace, when possible, certain drugs that could potentially increase the rate of bone loss, such as corticosteroids, and replace with more either bone preserving medications, or consider talking with your medical physician about ensuring that while you're on the medication, that your bone health is also preserved. Food is also a really big thing. So looking at anything to do with intolerances, so gluten intolerance, keeping your blood sugars as regulated as possible, but also ensuring that your insulin is sensitive. So testing for not just your blood sugar levels, but also your insulin levels is also going to be very beneficial in maintaining your blood glucose, and also just the long-term effects of being diabetic. And in order to control blood sugar, having protein in every meal, for example, and having sources of protein that are not high in sugar and high in the acidic factors, such as preservatives. So that acid-base matrix that we were talking about. getting into anything to do with nutritional deficits, and proper water and hydration for not just the dampening, but also the lubrication of joints. Maintaining dental hygiene is now one of our sources of inflammation, can actually come from the mouth. And there's this one suggestion in the States that probably oral health is either number 3 or number 4 when it comes to the inflammatory inflictions in the health of the body and brain. Sleep is going to be very important. We know that if you're not sleeping well, chances are you're going to be quite inflamed. And I know we didn't talk too much about that, but that's also something in a future talk, whether that be, inflammation or something along those lines, that we can talk more about it. But stress management, getting that cortisol too high can also be quite inflammatory. Having regular exercise, vitamin D and exposure to sunlight, smoking, and anything that has more of the acidic compounds such as alcohol, coffee, soda drinks, carbonated drinks, sugar, those can all play a role in the acid-base balance and potentially leading to that utilization of calcium, as we talked about, in buffering that acid. So one of the most commonly deficient sources of minerals or deficient nutrients has to do with magnesium. And so your chances are getting more magnesium in your diet can help dampen some of the inflammation and also support your bone health, as well as many other things, as we kind of briefly stated in the beginning regarding anxiety and muscle pain and brain health with magnesium. So some of the good sources of magnesium can come from spinach. I'd say to my patients, almonds and cashews, avocados and bananas. So these are really good sources of magnesium. Now, I'd be a little wary about potatoes, not to depend too much on the white potato, because that's also simple carbohydrate. But getting your plant and vegetable sources of magnesium is probably your best bet. Another nutrient is K2. Now, what is K2 and why have I never heard of this before? We used to have something just called vitamin K, which is now called K1. And K1 has more to do with the blood clotting aspect. K2, however, has been found to bring calcium from the blood into the bone. So you've probably have heard that vitamin D can help with getting absorbing calcium, but it's absorbing calcium into the blood. How does calcium then get from the blood to the bone? And that requires vitamin K2. And one of the most richest sources of vitamin K2, and this is probably why osteoporosis is almost inexistent in Japan, is natto. Has anyone ever had natto or fermented soybean before? In Japan, it's quite a delicacy. And for most Japanese, it is actually a staple in breakfast. Now, I don't know why there's this taco right here, but I'm laughing at this picture now. Maybe because there's shrimp in here. Let's just call it a shrimp taco. But even having the dark meat of chicken, you're going to get some level of vitamin K2, and you don't really need that much of vitamin K2. However, with the Japanese getting, majority, if not all their K2 from natto, it's understandable that osteoporosis is um, quite inexistent or even just very small in Japan. But yes, this is natto for those that have never tried it before. It's probably one of the most slimiest things I've ever had, but it actually goes quite well with rice. And if you can't stand it, then I suggest you put it in some egg and scramble it. And that might be also an easier way of not having to experience the sliminess of the natto. Resistance exercise is going to be a very big factor. And getting the body to have a little bit of stress so that it knows it has to get stronger to then be able to prevent future injuries or future fractures. So there are many ways when it comes to resistance, and it doesn't mean you have to go straight to a gym and start lifting as heavy as you can. But other resistance exercises are exercises that you may already know of. I try to make sure that if you are mobile enough, that even getting off your chair and doing, a number of repetitions. So sitting on your chair and standing back up being one repetition. In some cases, we like to call that a squat. If you can squat, do body weight squats or even light weighted squats, you're actually using your body weight to strengthen the hip bone and the femur, which is the largest bone in the body. And that could be one of the biggest things you could do in giving those instructions for the body to strengthen, or for the bones to strengthen. So do consider getting some level of resistance training. For some people, especially for those that are not as mobile, walking is probably the best thing, because you're still using your body against gravity to be able to walk. And so the bottom line is making sure that you are getting some level of physical activity. I like to say 30 minutes on most days. And if you can add some level of resistance, whether that be with weights, with resistance bands, or even with things that you can find in a household. Some people start, lifting milk jugs filled with water. That's still a really good alternative to weights. I know I was discussing this with my sister the other day, and I told her, how do you feel about using our cat kind of as a way to not just play around with, but to have a form of exercise? Kind of like those mommy and me exercise groups, but with a cat. And she looked at me with like the most sour face ever. Like, well, I have to get you to exercise somehow. So how do I know if I have osteoporosis? This is something that you would likely have talked with your medical physician. And the gold standard right now is something called a DEXA scan, or bone densitometry. Yeah, density. Just a scan for your bone density, or DEXA scan. And this will give you a grade of either on a range of, I believe, was +3 to -3, with 0 being normal. There are other potential tests that you can consider, though the best way is to make sure that you get this screened by your medical physician to know where you're at. But here we go, yeah. So looking at the T-score and the Z-score, and understanding where you score on the bone density spectrum. Then there are blood tests if you're ever curious about vitamin D status, for example, because we know that vitamin D helps with absorbing calcium into the blood. We can look into calcium if needed, not really always the first thing. But there's also another test that I do with my patients called CTX. And CTX just literally means how much of the bone is being turned over. If CTX is high, then I know there's a lot of kind of breaking in that point, a lot of the osteoclastic activity. And so that can tell me kind of like a screenshot of the rate one is going through. And that way, that could also be used to gauge, if we were to do any intervention for your bone health, to have CTX tested again, probably a few months from then, just to make sure that the CTX has decreased and thus the rate of bone loss is decreased. So heavy metal testing, there are quite a few heavy metals, including aluminum, that could displace bone. And that could lead to the thinning of bone itself. So I hope to make it short and sweet, but still very informative. But to summarize, there is more to it than supplementing just calcium. Like any other chronic condition, osteoporosis is really multifaceted. There's a lot of factors that we have to engage in order to really understand and to really work with osteoporosis and osteopenia. And thus, it all really comes down to the diet and lifestyle being the most crucial. The bottom line, just even though you're supplementing, all the right stuff, you're probably doing all the right stuff for your bone health. If you aren't addressing the breaking part of the balance, then what you're doing is probably not as effective. Really want to thank you for having me. I hope today was informative. If you don't know if naturopathic medicine is for you, then I invite you to chat and let's talk. You can also find me on social media. Find my website at www.drromyfungnd.com, or you can also find me, like me on Facebook, subscribe to my YouTube channel, and follow me on Instagram. And just exciting news from me before we get on with the Q&A. And if you do have any questions, please bring them to the chat right now, and I will be getting through them shortly. But I have started a blog series, and I have a blog scheduled to come out every week, and you'll be able to take a look at those blogs through my website. And if you have subscribed to my website, you'd be getting a weekly notification saying that the blog has been posted. So that's quite exciting for me to be one, collaborating with a fellow colleague whom I've studied more about aging with, and to be able to share some of that information out. Oh, this is probably the new one right here. Here's my QR code. Okay.